Are you ready? Okay, my name is Kelsey. We're going to talk about color-coded surgery today. Okay, so being that we're in the medical field and not just athletic training, obviously it's any medical field. Whenever you look in a text box, your arteries are red, your veins are blue, your nerves are yellow, and it always makes it very clear what's what whenever you look at a diagram like this, so we can pick out each different thing whenever we look at that. So whenever you actually cut open somebody though, like this is what it would look like in a textbook, and then you cut it open, and I know it's not very clear, but that's what it would look like in real person. And I don't know about y'all, but I can't tell what's going on in this, which this isn't exactly our major, but so Quinn Nguyen is a molecular biologist and also an otolaryngologist at UC San Diego in California, and she figured out how to use fluorescein to be able to light up cancer in patients and be able to make it easier to cut it out on the first try. So this is a picture of cancer in the peritoneal cavity, and yeah, it just looks like a bunch of mush from what I can tell. So whenever you inject the fluorescein into it, it lights up green. So whenever they go in there, they can turn the lights out and actually be able to cut it out completely the first time. And it makes it a lot easier, so they don't have to have so many surgeries to go back and cut more out and then test and then cut it out again. So last year there was supposed to be approximately 1.7 reported cancer cases, and if you can see the numbers, in Florida it's 125,000, which is ridiculous compared to everywhere else because we have so much sun exposure. And then California is probably the only other people that top us, but again, from sun exposure. So we're in a very high place for cancer, so we really should be a little more educated on it than I think that we do get. So some athletes with cancer, Eric Berry had Hodgkin's disease, and then Lance Armstrong and Eric Chanteau actually had testicular cancer, sorry. And Eric Chanteau was diagnosed a week before the Olympics and ended up still competing. And then we all know Lance Armstrong. And then Eric Berry was diagnosed and actually had a pretty quick recovery of like 7 months before he was able to return to play. So how does it affect us as athletic trainers? It's not a direct relation to us because we're not doing surgery, we're not cutting out cancer. We don't even really deal with cancer that much directly, but our athletes do have the potential, especially being in Florida. So by being able to cut it out the first time, they can have a quicker return to play, not have to have so many surgeries. And then the future of this is being able to inject it into nerves. So that could affect our orthopedics whenever they're doing surgery, as far as, you know, not doing so much nerve damage whenever they do have surgery. If they're in a really close area like the hip or something like that, they can kind of see what they're doing and not cause so much damage for the athlete and have a quicker return to play. That's all I got.